Thank you very much for the introduction. So I'll try to be as concise as possible, and I'll try to tell you some tips and tricks for interpretation of skull radiographs in small animals. So before I start with the uh, uh, interpretation part, you should know the basic radiographic opacities when you see a film on the screen. So we have basically 5 opacities. The first opacity is the gas opacity. Gas looks black. So wherever gas is there, it will look black. The next is the fat opacity, which is a bit brighter than black, that is grayish black. Uh, Brighter to that is fluid and soft tissue opacity, which is still brighter. So fluid and soft tissue will have the same opacity. So you can't differentiate on the radiograph that this is fluid or soft tissue, right? But both will have the same opacity. It is grayish white. It's still brighter than the fat opacity. And again, brighter than that is mineral opacity or bone opacity. So bone and minerals are the same. Bone is composed of minerals. So mineral will have a white opacity, brighter than the soft tissue opacity. And again, brighter to that is metal opacity, which is very bright white opacity. So this is the basic thing you should know whenever you want to read a radiograph, that you have to look for these opacities, these 5 opacities. So to make it more clear, I have a radiograph of abdomen, although this is a class or this is a lecture on skull, but I will show you the radiograph of abdomen to start with to understand these opacities. So all the black areas you see here, you can see the arrow. So all the black areas you see here or black areas in the intestine is gas. Brighter to that, this area. So I will take the pen. So this area from here to here, this area, that is fat. So you should know that fat looks like this. And then this area, this is soft tissue. This is liver. This area is soft tissue, that is urinary bladder. Soft tissue and fluid, I told you, have the same opacities. Then this is mineral opacity. The bones you can see, bones are mineral opacities. And metal will be brighter to that. So this R, you can make out that this R is a metal opacity. So these are the opacities which we should look out for whenever you see a radiograph, any radiograph, whether it is skull, abdomen, thorax, you have to look out for these opacities. So, whenever you evaluate any radiograph, so I will talk particularly about skull, you need at least 2 views to get a correct diagnosis. Single views, we usually take one view because we say that owner cannot afford or we don't have time. But ideally, you should take 2 views to get a correct diagnosis. One view may not be sufficient. Especially in skull, there are so many structures superimposing on each other that a single view sometimes, makes it very difficult to interpret completely. The second important thing is positioning should be correct. You should have a knowledge of positioning because in skull, positioning plays a vital role. If positioning is not correct, your interpretation may go wrong. And third is, this is a very common question of our pet practitioners, that what factors we will use when we want to take a radiograph of skull. So we should use 10 to 15 milliampere second, that is MAS, and 55 to 65 ADP for a meter means 20 log. Always prefer sedation or anesthesia whenever dog is not cooperative, or whenever you have to do certain procedures which require, let us say, opening of the mouth or positioning of the dog in certain difficult positions, And then you should have a good knowledge of anatomy. Use your imagination because the X-ray is a 2D picture. So you have to construct a 3D picture out of a 2D image. So use your imagination. You have 2 pictures. in your brain, you just compile the two pictures and try to construct a 3D picture that this should look like, or this should be the shape of this organ. So that is the trick of reading radiograph. And don't be ashamed of referring to anatomy books. Nowadays, Google is there. So it is very easy to refer. So refer to anatomy books or maybe literature from the Google to see what structure actually is involved, or if you are in a doubt to compare the normal or abnormal area, you can refer to the books. So for the skull, this terminology is very important. The side towards the nose is rostral. The side towards the head is caudal. So you should know this terminology. Lateral is easy. Lateral everybody knows. Right lateral means right side down. Left lateral means left side down. But you should know that rostral is toward the nose, caudal is toward the base of the head or towards the forehead. When you are seeing the radiograph on the screen, always view the radiograph in a same position every time you put it on the screen, maybe on the mobile. If you are having a radiograph on in your hand, the nose of the radiograph or the dog should be on your left. The body of the dog should be on your right. The dorsum or the dorsal of the head should be uppermost, and the mandible should be lowermost. So this is the position you should always keep the radiograph in while viewing the radiograph. Never flip the radiograph every time you see. That way, your eyes will not get trained to see the radiograph in a particular manner. So always keep the radiograph like this. This is the correct way of seeing the radiograph on your left, and on your right is the wrong way. You should not keep the radiograph like this, because if you flip it every time you see, then you are basically missing some lesions, because your eyes are not trained to see it opposite way. And when you are seeing a VD or a DV radiograph, your right should be patient's left, your left should be patient's right. So always this side will be left side, and this side should be the right side. This is the correct position of the radiograph of skull. You should not, flip it again and again. Left should not come to right, right should not come to the left. Because again, then it will lead to confusion that this side is involved, right side is involved, or left side is involved. So always on your right is the left side of the animal, on your left is the right side of the animal. That is the position of the film for interpretation of radiographs. So there are so many types of dogs which come to your clinics or which come to your hospital. There could be brachycephalic dogs which have a flat face, pugs, boxers. There are mesocephalic or mesocephalic dogs like beagles, Labradors, which have a normal face. And then there are dolichocephalic dogs which have a pointed snout like Doberman Pinschers, Greyhounds. So whatever the breed is, the anatomy will not change. The anatomy or basic anatomy will be the same. The shape of the bone can change. Some may have a curved mandible, like in brachycephalic, you see the mandible, it is curved. Some may have a straight mandible, some may have a long nasal bone, some may have a short nasal bone. I will discuss all these things as we go along. So the anatomy will not change, the anatomy will be same. The shape of the bones can change. So the structures will be the same. So why do you need radiographs of skull? You should understand that radiographs of skull are required when you're suspecting a nasal disease. Nasal disease means you're suspecting some infection in the nasal passage. You're suspecting some fungal nasal disease, bacterial nasal disease, or allergic nasal disease, foreign body in the nasal passage, or any kind of problem in the nasal passage, maybe polyp in the nasal passage. So you want to take a radiograph of the skull for that. Then if you're suspecting a dental disease means if the dog is having a tooth abscess, or if you are suspecting a fracture of the tooth root, you can take a radiograph. Nowadays for dental diseases, dental radiography has come up. So nowadays we have special machines for dental radiography. So dental diseases, like normal skull radiographs are used only when you don't have a dental unit with you. Then if you're suspecting ear problems. Now ear problems are very, important. Otitis externa. Otitis externa means external ear canal is involved. It's easy to diagnose on clinical examination. The dog will come with the pus discharge from the ear. Um, and you know that it is otitis externa. But if you are suspecting calcification of the ear canal, then you require a radiograph of skull to see whether the ear canal is calcified or not. Uh, otitis media. Otitis media means when there is infection in the tympanic bulla or middle ear. Then also you can take radiographs of skull to see otitis media. Then if there is any cranial, facial, mandibular swelling, that means you are suspecting a tumor, you are suspecting some hyperparathyroidism, or you're suspecting some fracture, edema, uh, hydrocephalus. You can take a radiograph of skull. Oral masses, again, it is the same. Exophthalmos. See, eyes are not seen on radiograph. So you can't see eyes on the radiograph of skull. So exophthalmos, why I'm taking it as an indication is, in some dogs like pugs, the eyes are having natural exophthalmos. That means the breed is having exophthalmos, it's okay. But if a Labrador or a German Shepherd comes to you with exophthalmos, like a pug, the eyes like a pug, or the eyes are protruding out or bulging out, then you suspect that there is something which is pushing the eye out, something lying behind, which is pushing the eye out. Maybe a retrobulbar abscess, maybe a retrobulbar tumor, or a tumor in the back of the eye, which is pushing the eye out. So for that, you can take a radiograph of skull. And of course, trauma, you're suspecting a fracture, maybe fracture of mandible, maxilla, uh, uh, cranium, frontal bone. You can take a radiograph of skull. So there are so many views given in literature: lateral view, dorsoventral, ventrodorsal, oblique, and so on. I'll be discussing some views which are really important in your clinics. I'm not going to unnecessarily trouble with you with many views. So first of all, I'll talk about the lateral view. This is the most commonly used view. You don't need to sedate the dog for this. You can just take the dog into the X-ray room, put the dog on the table, and take this view. Now, you see two pictures are given here. The correct picture is the bottom picture. Why? Because the shape of the head or shape of the head of dog is conical. So if you place it like what is shown in the figure number 1, then what happens? The radiograph becomes oblique. So ideally, when a radiograph is taken, the beam should X-ray beam should come from one ear and go out of the other ear. Here, the X-ray is coming from one ear and going out through the eye of the dog. So this becomes an oblique view. So this view is not recommended, and this view is the correct view for taking radiograph of skull. So how you take this view is put a small wedge, a foam, or maybe a cotton piece, or maybe some cloth, which will not give any image on the radiograph, under the nose. so that the nose and the neck are in the same line. The nose and the neck are in the same line. That way, your radiograph becomes lateral. And when you take a lateral radiograph, this is the picture you get. Now, if it is a true lateral, you will see only one mandible. The second mandible is not seen because it is exactly superimposed on the other one. So this is a lateral radiograph. Now, on this lateral view, I'll tell you 10, 11 points which you have to see in a deliberate manner. Deliberate means you have to evaluate these 10, 11 points. If you evaluate these 10, 11 points, you should be able to diagnose the condition in 99% cases. So the first is the mandible. So if you see this, that is the horizontal rami of the mandible. That area belongs to the horizontal rami of mandible. Now you have to look out for any break in continuity of the mandible. You have to look out for any lysis of the mandible. You have to see whether there is any fracture of the mandible or there is any periosteal reaction in the mandible, or you have to look out for the density of the mandible. That means you should be able to see the mandible. The density of the bone or the bone density or the mineral density should be seen. If you're not able to see the mineral density, then there is a problem with the mandible. So this is the horizontal rami. That is the first thing you have to evaluate. The next is the vertical rami of the mandible. So you have to evaluate the vertical rami of the mandible, and that vertical rami can also be fractured. So you have to evaluate that vertical rami of the mandible. Again, all the same things: lysis, fracture, bone density, and so on. Then you have to evaluate the teeth. So you know the teeth. This is the canine teeth. These are the premolars, and this is the first molar. First molar, why I have labeled it? Because first molar is the strategic teeth, or also called as the carnassial teeth. First molar of the lower jaw, fourth premolar of the upper jaw. These are the carnassial teeth used for tearing and shearing forces in dogs. These are strategic teeth, and these should be evaluated carefully. So this is the first molar of the lower jaw. This yellow line you see here, that is the nasal bone. So that is the nasal bone here. You see this yellow line, that is the nasal bone. Nasal bone should be evaluated for fractures, lysis, or sometimes the nasal bone can be elevated from its normal place. So you have to evaluate the nasal bone properly. The next is this area. This is the area of ethmoid conchae, ethmoid conchae. So this area belongs to the ethmoid conchae, and this area belongs to the nasal conchae. Overall, this total, this and this are the turbinates. So this area should have some gas opacity and some crisscross bony opacity. So both opacities should be there because there are turbinate bones. So you should see the bones as well as you should see the gas also in this area. That is the frontal bone. Frontal bone is on the forehead of the dog. And below the frontal bone is the gas-filled sinus, which is called as the frontal sinus. So frontal bone again should be evaluated for any lysis, fracture, tumor, and the sinus should be evaluated for gas or fluid opacity. And this is the cranium or this is the cranium which holds the brain. This should be evaluated for fractures in trauma patients. This semicircular thing you see here at the bottom, this semicircular thing is the tympanic bulla. Tympanic bulla is the middle ear of the dog. This is not the right view to evaluate the middle ear, but you can see the tympanic bulla here. So I will tell you which is the right view. So if you evaluate these 10, 11 points in a systematic manner, you should be able to diagnose most of the conditions of skull on a lateral view. Uh, The next view is a dorsoventral view. Dorsoventral means the beam is coming from the dorsal side and going out through the ventral side. So the beam is coming from top and the cassette is placed here. The cassette is placed here. The beam is coming from the top like this into the cassette. So this view is very good to see some structures. So I'll tell you here you have to evaluate 5 to 6 structures. If you evaluate those 5 to 6 structures, you should be able to correctly read this radiograph. So the first structure is the center line you see here. That is the nasal septum. Nasal septum divides the nasal passage into 2 equal halves. So you should be able to see the nasal septum nicely. The nasal septum should be straight. It should not be deviated. If it is deviated, it is a problem. It should not show any lysis. If it is lysed, then there is a problem. So it should be a straight mineral opacity in the center, dividing the nasal passage exactly into 2 halves. That is the nasal septum. These 2 triangular areas are again the turbinates. This area is the nasal passage. These contain turbinates. If you see carefully, you will see the gas opacity as well as you will be able to see the crisscross bony pattern. The crisscross bony pattern are the turbinates, and this crisscross bony pattern along with gas should be seen. If it is not seen, there is something going on in the nasal passage. This is a very important point that you should be able to see the turbinates. This is the zygomatic arch. Now I'll go back and try to show you on this. This curvature or curved structure is the zygomatic arch here. Zygomatic arch has 2 processes from hair to hair. This is the zygomatic process, and from hair to hair is the temporal process. Overall, the whole thing is called as the zygomatic arch. This is a very important structure, and there are lot many tumors which arise from the zygomatic arch. So you should be able to diagnose these conditions. You should look for lysis. Can the organizers mute everyone, please?
Excuse me, we request everyone to mute your mic. Yes, sir, please. Please continue.
So,
sorry.
So
Sir, Mohindroo sir also muted, sir.
Dr. Mohindroo, you have to unmute yourself. Sorry.
Please unmute yourself, sir.
Yes,
Okay.
sir. Yes.
Thank you. So these structures which you see here, which I have outlined with the red color, these are the tympanic bullae. These tympanic bullae are having air, or should have air in it, along with, there are bones in it, the malleus incus stapes. So you should be able to see air and bony structures inside the tympanic bullae. So this is the next structure you should evaluate. The next structure, this is the tympanic bullae. These are the ear canals. These black opacities you see here, you can see now I have gone back and you can see the black lines there going out. These are the ear canals. The ear canals should be patent, should have air inside it. If there is no air, or if there is fluid, then you will see fluid opacity and ear canal will not be visible. If there is calcification, then you will see calcification of the ear canal in chronic otitis. So these are some 5-6 structures which you have to evaluate on this particular view, a dorsoventral or a ventrodorsal view. Now the problem with this view is that the mandible superimposes on the maxilla. So I'll just show you. That is the mandible. That mandible superimposes on the maxilla. That is the problem of this view. So you are neither able to see the mandible properly, nor able to see the maxilla properly, because both are superimposed on each other. So you may require another view to see the maxilla separately. So I'll go again. These are the ear canals. These are the incisors. Now you have to look out for the teeth, incisor teeth, whether any teeth is missing. There are the central incisors in the middle. Then there are, the middle incisor, the central incisor, and the corner incisor or lateral incisors. So these are the incisors. Then these are the canine of upper jaw and lower jaw. These are the premolars. And again, the upper fourth premolar is seen here. That is the upper fourth premolar, which is the carnassial tooth. You have to see whether this tooth is okay or not, whether it is deviated, whether it is lysed, or there is some problem. Dental fistulas very commonly occur in this particular teeth. This is the mandible, of course, I told you. And this is the coronoid process of the mandible. Now, this coronoid process of the mandible is an important structure. Sometimes can get fractured, sometimes can get involved in tumors. You should evaluate this coronoid process of mandible. So these are some structures which you see. This area of the maxilla, the mandible properly. So to see the maxilla properly, you need this particular view. This is an open mouth VD view. Here the mandible is pulled away and the maxilla is positioned flat on the table like this, and the beam will come like this into the cassette. So the beam will come like this into the cassette at an angle of about 20-30 degrees, and you can get a good view of maxilla. This is the maxilla. Now here you are able to see maxilla more clearly because the mandible is no longer superimposed on each other on the maxilla, and you can see the nasal septum nicely. You can see the nasal passage. You can see the crisscross pattern. You can see the incisors of the upper jaw, the canine, the premolars, and the fourth premolar here. So this is an open mouth PD view. Very good to see the maxilla and the nasal passage. And suppose you're suspecting a case of frontal sinusitis, and the dog has come to you with the lowered head, the discharge from the nostrils, pussy discharge. and you want and when you do a percussion in the frontal area, you feel a dull sound instead of a tympanic sound. You're suspecting a frontal sinusitis. You take a view called as frontal view or rostrocaudal frontal sinus view. So in this view, you have to take the radiograph with the animal positioned like this, with the nose towards the sky, and the beam should X-ray beam should come in between the eyes into the cassette, and you will get this particular picture on the screen. This is the frontal sinus. On your right is the patient's left. On your left is the patient's right. I told you already. So the frontal sinus should be filled with gas and some septations. If instead of gas there is fluid or soft tissue inside the frontal sinus, then that could tell you that there is something going on within the frontal sinus, then that is an issue. You can take lateral oblique views to evaluate this particular joint. This particular joint is called as the temporomandibular joint. That joint you see here, that is the temporomandibular joint. Now this oblique view is very important when you get a patient which has a history of, the owner comes to you and tells you that the dog was fine in the morning and I threw a ball, he went after the ball, came back, and now he's not able to close his jaw. So the jaw is kept open, tongue hanging out, and the owner comes to you in panic, and you suspect a temporomandibular joint dislocation. Now, that is a very important condition to diagnose, and then you have to relieve the condition by doing some manipulations and giving GA and doing a reduction of the joint. So this is a temporomandibular joint. So you can take an oblique view for temporomandibular joints like this. This is the positioning I have shown you in this image. And you can take oblique views to see both the mandibles, because in a lateral view only a single mandible is visible. Both mandibles are superimposed on each other. So if you want to take or evaluate both the mandibles, you want to take an oblique view so that you are able to evaluate both the mandibles. If you're suspecting a fracture of the mandible, which side is fractured, you can take an oblique view to evaluate the site of fracture. So this is an example of a unilateral mandibular fracture, and you can see that one mandible is fractured, the right one, the left mandible is intact. You can see the mandible lining, it is clear, so the cortical integrity is there. So the mandible, this mandible is fine. This mandible is fractured. So if you evaluate all the structures visible on this view, you will come to know that the teeth is also fractured. So if you see that this particular teeth, the third premolar is fractured. Now the third premolar is very clearly fractured here, and even if you treat this dog with, let us say, interdental wiring or pinning or whatever, then also you have to remove the teeth. If you fail to remove the teeth, then the dog will have pain throughout his life because the teeth is broken from the center into two pieces. So you have to remove the teeth and then you have to do the surgery. So it is very important to comment on the teeth when you are evaluating a radiograph of a skull. Then these are intraoral views. Earlier we used to use these views because we didn't have this dental radiography units. But nowadays dental radiography units have come up, so you can use this dental machines, nice machines with small cassettes. You might have visited dentist, everyone, so you know how dental views are taken. These are radiographs are when you don't have a dental X-ray unit. So you can put the cassette inside the mouth of the dog after giving GA, of course. You have to give GA to the dog. If you don't give GA, the dog will bite off the cassette. So give GA to the dog, put the cassette inside the mouth as much as it can go in. the corner of the cassette, and take the view. A DV view is used to see a maxilla. DV means dorsoventral. When I say dorsoventral means the beam comes from the dorsal side, goes out to the ventral side. So if you see DV, I say DV has two terminologies. One is D. D is dorsal. So the first one is from where the beam is coming. The second one is from where the beam is exiting the body. So dorsoventral means the beam is coming from the dorsal side, going out through the ventral side. So you are seeing the maxilla. A ventrodorsal means the beam is coming from the ventral side, going out through the dorsal side of the body. So you are seeing the mandible. The dog is positioned in a dorsal recumbency that way. So this is the maxilla. And this is the mandible. You can see the two rami of mandible. So this view is very good to see the canine, the rostral part of the mandible and maxilla. But this is not very useful view because your area of radiograph is limited. You are only able to see only the rostral part. So no longer this type of view is used. Nowadays you have dental radiography units. If you want to evaluate the teeth, this is a beautiful dental radiograph which we took here, and you can see there is the lysis of around the teeth. You can see this is an apical abscess around the teeth. So nowadays dental radiography has come up. So I mean to say that you don't need to see the teeth very carefully as regards to abscess and all. You can go for advanced procedures. And this is a very beautiful view, basilar view, or also called as rostrocaudal open mouth view. Rostro means from here. Caudal means hair, I told you in the beginning. And open mouth, the mouth of the dog is open. And the beam comes from the top, goes inside the throat of the dog into the cassette. Right? So this is the rostrocaudal view, also called as the basilar view. This view is recommended for seeing the tympanic bulla. So this is the tympanic bulla. You can see this round structure here and this round structure here. That is the tympanic bulla. Just see like an eye. You can see that is the tympanic bulla, and one side of the tympanic bulla is filled with gas. That is normal. That is how the tympanic bulla should look like. One side is filled with fluid. That is abnormal. So now I hope that you are able to know which side is normal and which side is abnormal. So on your left is the right of the patient. So the right tympanic bulla is normal. On your right is the left of the patient. So the left tympanic bulla is fluid filled. So this is a case of otitis media. So this is how you diagnose otitis media. keys to radiographic interpretation. You have to evaluate all the structures in a deliberate manner. So I have told you 10, 11 structures in lateral view, 6, 7 structures in VD view, same structures in DV view, basilar view, some structures I told you. Open mouth VD, I told you some structures. So these structures should be evaluated in a deliberate manner. Deliberate means you have to tick off all the structures. Horizontal rami, okay. Vertical rami, okay. Teeth, okay. Nasal bone, okay. Nasal passage, okay. Frontal bone, okay. Frontal sinus, okay. Cranium, okay. Tympanic bulla, okay. That way, if you write all the points on your report, then your diagnosis will be correct. You will be able to reach at a diagnosis. If you miss certain parts, you will definitely miss the lesion. You should use appropriate views as per the condition suspected. For example, you're suspecting otitis media, go for a basilar view. You are suspecting a temporomandibular joint dislocation, go for an oblique view. You're suspecting for a mandibular fracture, go for an oblique view. So views are very important. You are suspecting a nasal passage tumor, go for an open mouth VD view. So views are very important. Use appropriate views as per the condition suspected. Take multiple views wherever required. Give general anesthesia to the dog wherever required, and you should get a good diagnosis. So how to evaluate a skull radiograph? So look out for changes in opacity. See whether the opacity is okay or not. Whether there is any bony lysis. Lysis means the bone is eaten up, or there is break in continuity means there is fracture. Look for increased soft tissue or fluid opacity, like I showed you with the tympanic bulla. The tympanic bulla was filled with fluid. So look out for fluid opacity, or there may be both bony lysis as well as fluid opacity. So both can be present. Are the nasal terminates still visualized? I told you nasal terminates are a very good, indicator. So are the nasal terminates still visualized? And the beauty of skull is everything is paired. Everything is paired. Nasal passage is paired. Zygomatic arches are paired. Tympanic bulla are paired. Ear canals are paired. Teeth are paired. So you cannot use the opposite side for comparison. Radiographic changes are not specific for specific disease. That means that suppose there is fluid opacity in the nasal passage. Let us say there is fluid opacity in the nasal passage. You are not able to see the terminates anymore. Now there are a list of differentials. It could be simple rhinitis, jukam lag gaya, rhinitis. It could be fungal, aspergillosis. It could be a tumor. Bone tumor will give soft tissue opacity. Soft tissue and opacity and fluid opacity are same. It could be some foreign body. It could be blood in E. canis, epistaxis. It could be allergic rhinitis. It could be bacterial rhinitis, fungal rhinitis, tumor. So many things are there. So the changes will be same, but there is a list of differentials. So how to proceed further? So go for further tests. You can take a swab, put in the nose, make a smear, send it for cytology, rule out fungal, rule out bacterial, rule out tumor to progress further in your diagnosis. So this is how you proceed for diagnosing skull conditions. So this is a frontal view, and I think you should be able to easily diagnose the condition. So the left frontal sinus is not normal. It is filled with soft tissue opacity. The right frontal sinus is normal. So this is the frontal sinusitis of the left side. What about this? I hope that you should be able to make out that the nasal terminates are no longer visualized clearly. You are seeing a soft tissue opacity in the nasal passage. So the nasal terminates are not visualized properly. And even you see this area is showing lysis. This area is showing bony lysis. So this is definitely something aggressive which is going on in both the nasal passages. So you should go for further swab and cytology examinations to rule out fungal and bacterial disease. Here, this is the left side. So this is the right side. I told you your right is the patient's left. So which side is involved? I hope that you are able to make out that this side is not normal. I'm not able to see the turbinates here. Here I am able to see the turbinates. So this side is having fluid opacity. So this is not normal, the left side. The right side is normal. Here, frontal sinus, frontal view. So this side is involved. This side is normal. So I told you your left is patient's right. So right frontal sinus is involved. It is having fluid opacity or soft tissue opacity. Here also again right frontal sinus is having fluid or soft tissue opacity. So it is frontal sinusitis. What about this? I'm sure you are able to make out that this is eating up of bone or lysis. Now this is a nasal bone lysis. This picture is a zoomed version of this picture. So this is the area which has been zoomed and shown in here, and you can see that there is lysis going on. The bony lysis is there. How do you differentiate this lysis from fracture? So fracture will have sharp margins, and you can reconstruct the fracture into normal bone in your mind. So if you try to in your mind just try to reconstruct it, you will be able to make a normal bone. But lysis means the bone is resorbed, the bone is eaten up. So here if you see the nasal bone is eaten up. So that tells you that there is some aggressive thing is going on which is eating up the bone. This usually happens with tumors and or osteomyelitis, infection. So infection and tumors eat up the bone. So this is lysis of the nasal bone. Here, just see this. The nasal septum, it is not straight anymore. It is irregular. There is a soft tissue opacity here. There's a soft tissue opacity here, and here the nasal bone is totally eaten up. So the same dog, two views, and the nasal bone is eaten up. There is soft tissue opacity in the nasal passage. So this tells me that this is likely to be a tumor of the nasal passage, involving the nasal passage. Just see the nasal septum, it is deviated. And the nasal passage is having lytic area, so many lytic areas. So there's a tumor which is invading from one nasal passage into the second one. So there is invasion like this. So it is invading into the other nasal passage. The nasal septum is deviated towards the left side. So that tells me that this is definitely a tumor. Also, this incisor is missing. Now this is a case. So this is a pup which is having a big head. This is the case of hydrocephalus. Now, how do you know that this is hydrocephalus? There are few things you should look out for. First is the size of the head is not proportionate to the skull or body. So the head is abnormally big. And second is the bone here becomes thin. The bone of the calvarium becomes thin, papery, and the head is abnormally big. That tells you that this is likely to be a case of hydrocephalus. This is another example. Just see this. Just see the skull or head of the animal and just see the cranium. how big it is. So this is a case of hydrocephalus in a pup. This came very recently to us. And here, this is a fracture. This is a fracture of the right frontal bone. Just see, the edges are sharp. This is not lysis. This is fracture of the right frontal bone. And the left frontal sinus is also having some fluid opacity. Now, from the history, you know that this is a case of trauma, and the right frontal, when you take the radiograph, you know that the right frontal bone is fractured. So this fluid opacity in the left frontal sinus is likely to be blood. So this is likely to be hemorrhage in the frontal sinus, going by the history. So that is how you proceed for the diagnosis or differential diagnosis. Now, the upper radiograph is a normal radiograph. Just see the density of the mandible, and the lower radiograph is a dog which is suffering from poor density of the mandible or rubbery jaw condition, also called as secondary hyperparathyroidism. It may be renal secondary hyperparathyroidism, or it can be nutritional secondary hyperparathyroidism. In that case, what happens is there is calcium depletion from the body and the bones become rubbery. The teeth will appear as if they are floating in the air because mandible is no longer seen. The mandible density is gone. So, such cases will come to you with a swollen gums. All the gums, upper jaw, lower jaw are swollen, especially seen in Labradors, Rottweilers. A lot of cases come to us. This could be either secondary to renal disease. This could also be either secondary to a poor nutrition or improper nutrition. So you should be able to diagnose this condition. Now this is a very beautiful radiograph where the canine is displaced. Just see the canine. The left canine is malpositioned, and you can see the angulation of the left canine tooth. Also, the corner incisor is missing. So if this is a history of trauma is there, then it's likely to be traumatic in origin. But if there is no history of trauma, then this could be some tumor which is pushing the canine to or displacing the canine to one side. So you have to know the history to diagnose this particular condition. This is a odontoma. Odontoma usually are calcified or mineralized structures arising from the mandible. The teeth will also be involved, and the teeth will, erupt along with the odontoma. Easy to diagnose. And epulis are lytic lesions seen in the mandible. These are growths at the gingival margins. You can see lytic lesions, very well-defined lytic lesions like this. These are epulis. Then otitis externa. Otitis externa is, I told you, otitis externa, otitis, how it proceeds or how it progresses in a dog is first the dog gets infection of the external ear canal. Now what happens is if you treat the infection fine, the dog will be fine. If you don't treat the infection, chronic irritation is there in the external ear canal. And due to that, the ceruminous glands become hyperplastic. And then it is termed as hyperplastic otorrhea. If you still don't treat it, then you will find calcification of the ear canal. Calcium deposition starts occurring and the ear canal gets calcified. So when you get a hyperplastic otorrhea, you will see cauliflower-like, growth at the, opening, ear opening. You know that this is otitis externa. But sometimes the ear canals get calcified. You need to take radiographs to see whether you need ZEPS procedure, or you want to do a total ear canal ablation. So you take a radiograph, the whole ear canal is calcified here. Just see both the ear canals are calcified. So you need to do a total ear canal ablation. Even the tympanic bulla, you see, both the tympanic bulla are also calcified here. So this is a chronic otitis externa as well as otitis media. So both, this is a very old case which is worsened over a period of time. And just see the mineralized ear canals. They look like horns here and here. So sometimes the ear canals get mineralized and so badly. Here also you just see the mineralization of ear canal. Just see the mineralization of ear canal here and here. So when you get such cases of mineralized ear canals, you don't have any option than to, you know, do a total ear canal ablation. Now this is otitis media. This is a basilar view, and you can make out, I suppose, that the left middle ear is having fluid opacity as compared to the right middle ear. So right middle ear is having gas opacity, or right tympanic bulla is having gas opacity. The left tympanic bulla is having fluid opacity. So this is an otitis media here. And this is oblique view of skull, and you can see there's a mandibular fracture of the right mandible. Now, whenever there is a fracture, you have to write that this is oblique or transverse fracture, number one. Second, you have to write at what level the fracture is, whether it is at the level of premolar, first premolar, second premolar, third premolar, fourth premolar, molar, between molar and premolar, whatever. So you have to define the site of fracture so that you may not be the person who is operating. You may be the person who is writing the report. The person may consult some other doctor, so the other doctor should know where the fracture is and how he is going to treat the case. Now this is a very good radiograph showing bilateral fracture of mandible. You can see that there is a fracture here and there is a fracture of the other mandible as well at the level of angle of mandible. The angle of mandible is where the vertical and horizontal rami join. So this is a bilateral mandible fracture. Just see again, I am showing you. So this is a very tough case to treat, because the fracture is at the angle of mandible. Very difficult to approach this particular case, but yes, you can do with surgery. And this is a trauma case where there is a fracture of cranium. Now, whenever you write a report that the cranium is fractured, you should also write comment about the edema here. Just see there is fluid opacity on the top of the cranium. So there is edema here. So you should write that there is edema on the top of the cranium or dorsal aspect of the cranium, and the cranium is fractured. So never give incomplete reports. You have to give complete reports. then there is a condition called as craniomandibular osteopathy. This is in growing dogs usually seen, and there will be periosteal reaction at the cranium, at the mandible, at the temporomandibular joint, at the maxilla. So here you will see irregular periosteal reaction. Now, generally what happens is this is a very difficult condition to treat in the sense that the dog will be very painful for the dog. So the dog, you have to manage the dog with pain medications. That's the only thing you can do. Once the dog attains the full adulthood or maturity, then the symptoms will subside. So that period of pain medication is what you have to take care of. You have to give a lot of fluids so that the dog does not starve, because it is very painful condition. So you will see calcification here and there in the cranium and the mandible area. Now this case came to us recently, and you can see the mandible. There is a periosteal reaction here and the mandible. So this was diagnosed as a craniomandibular osteopathy. So you can see the periosteal reaction here, and we manage this dog and doing fine. Now, this is another example of if you deliberately see all the structures, you should be able to see the the incisors here, the canine here, the teeth here, the premolar here, and then you will see that there is a soft tissue swelling here, and you will be able to see that the right zygomatic arch.
Sir, you are mute. Sir. Doctor Sahab, you are mute. Doctor Sahab, please unmute yourself. Your mic is muted. You are not able to? Just let me check. किसी ने और म्यूट किया है क्या? नहीं. Sir, you are unable to unmute yourself?
Yes, now I am unmuted.
Yes, yes, audible.
But I have not muted. Somebody has muted me.
Oh, I'm really sorry, sir. Sir, last slide, the end of the last slide. Yes.
Just a minute. Now I have to reshare, na?
No, you are already on sharing. We are seeing, but it is not full screen. Or maybe it's hanged.
Now?
Yes, sir. Yes, sir. It's full screen. The last slide we were seeing.
This one?
Yes. Yes.
So this is the there is a soft tissue swelling here on the right side, and the swelling is appears to be originating from the lysis of the zygomatic arch. So you can see the zygomatic arch is lysed, and there is a swelling arising from here. So this is a tumor of the maxilla arising from the zygomatic arch. So you have to deliberately see all the structures, the nasal septum, the nasal passages, the tympanic bulla, the ear canals look fine. The zygomatic arch, this side is fine. This side is lysed. The coronal process is okay. The mandible looks okay. The incisors are okay. So that way you have to go on for doing the interpretation. So you have to make a checklist and write all the things, and you will come to the diagnosis very easily. So this is the basilar view again, and you can see that there is the otitis media of the left side. And this is a very beautiful radiograph. I have taken this from the internet because I didn't have any such case with me. So this is the radiograph of a cat, and there's a foreign body in the nasal passage of a cat. So sometimes the dogs sniff up the foreign bodies. So if they are metallic, they can easily show up on the radiographs. We got a case of the dog had sniffed up an earbud, but that did not show up on the radiograph, and we had to do a rhinoscopy to see it and take it out. But metallic objects can easily be seen in the nasal passage. So this is a metallic object in the nasal passage of a cat. And this is the temporomandibular joint. And this is the luxation of the joint. You can see the joint is luxated here or subluxated, of course. And this is the mandible fracture at the level of first premolar, very easy to diagnose, oblique fracture. And now just see this particular radiograph. Now, when you see this radiograph, if you try to evaluate this radiograph, if you see, give it the first look, it looks okay. Everything is fine. Everything is fine. But when you start deliberately evaluating this particular radiograph, you see that the incisors are fine, the canine are fine, the premolars are okay, the molars are not seen but okay. The zygomatic arch is fine, the zygomatic arch is fine, the nasal septum is fine, the nasal passage is fine. Then you come to the tympanic bulla is okay, then this ear canal is okay, but here this ear canal is missing. So when you evaluate this particular radiograph in a systematic manner, then you can know that this ear canal is not visible anymore. The gas is not visible. That tells you that if gas is not visible, then it is fluid or soft tissue. So this ear canal is filled with either fluid or soft tissue or some foreign material, and this ear canal is blocked. So you have to treat this case accordingly, so that this does not change into otitis, chronic otitis externa, or it does not calcify. Here, this was a very interesting case which came to us. The dog was, the owner did not have a history of any trauma, and the dog was having a large wound on the left ear, base of the left ear. And when we took the radiograph, we found these metallic opacities. So this was a gunshot wound. So owner also did not know that the dog had been shot at. So these are splinters of gunshot which were seen at the base of the ear. So this was an incidental finding for us. We suspected it to be a chronic otitis externa, or maybe a maggot wound was there. So we were suspecting a chronic otitis, but it came out to be a metallic opacity. So just see the metallic opacity. This is how metallic opacity looks like. So these are splinters of a bullet which we got. Now this case, I hope that you should be able to diagnose. Just see the teeth. They are ill-organized, floating in the air. You can't see the mandible anymore. I'm sure that you are not able to see the density of the bone. The mandible is absolutely gone. This is a case of rubbery jaw. This is how a rubbery jaw looks like. Just see the bone, all the bones, even the cranium is not visible properly. The mandible is totally not visible. So all the bones are rarefied. The calcium depletion is there. Zygomatic arch is also not visible. Just see the zygomatic arch, poorly visible. So this is a very beautiful example of secondary hyperparathyroidism. It could be a nutritional or a renal. Go for a kidney function test to rule out renal, calcium phosphorus ratio and all. These are both of these are examples of secondary hyperparathyroidism. Just see the teeth, how ill organized they are. So this is how you diagnose this condition. Very common in Labradors and Rottweilers. We get a lot of cases of secondary hyperparathyroidism, Labradors and Rottweilers. And again, when you see deliberately the teeth, the nasal passage, sorry, the nasal septum, the nasal passage, the mandible, the zygomatic arches, and then the ear canal, you see that there is calcification of the ear canals. Both ear canals are calcified. So this requires a total ear canal ablation. So remember, radiographs may be sufficient for fractures, ear infections, but not always for intranasal intracranial disease. So you have to go for further tests, go for a cytology, go for a swab, culture, fungal culture, bacterial culture. Go for hemoprotozoans to evaluate further and give your diagnosis. So with that, thank you very much for your patience, and I'm sorry for the inconvenience.
Thank you
Due
so
to
much,
the
sir. No
internet.
need to say sorry, sir.
So Dr.
Sir,
Vishal.
we can take, I think, question and answers if somebody has any queries.
Sure.
Sir, myself, Dr. Apurva Mishra, I had one query. Hello? Am I
Sir,
audible?
Doctor,
Yes, I am audible. You are audible, ma'am. You are audible.
Sir, actually, we get some cases of nasal polyps or growth in the nasal cavity.
Yeah.
So, can we distinguish that? Matlab, what are the characteristic radiographic findings in case of nasal polyps?
See, nasal polyps will give you a soft tissue opacity in the nasal passage. So unless the polyps are hanging out of the nostrils, they will just give you a soft tissue opacity in the nasal passage. That's all. Unless you are able to distinguish a pedunculated mass. In large animals, we are able to easily say that this is a polyp because they are round, pedunculated. On the radiograph also, you are able to see very round, nice masses. But in dogs, if you get polyps, it is a soft tissue opacity. So you will just see that there is a soft tissue opacity of the nasal passage. Turbinates are no longer visualized. So that is all, nothing else.
Okay, sir. Thank you.
Are you able to see the chat box, sir?
No, let me see. Yes, I can see. Let me try to.
There is one question: how to treat extra-articular TMJ ankylosis? Dr. Anil has asked. The last question.
Ankylosis, you can't, once it is ankylosed, you can't treat it. Just painkiller, pain medications are to be given, muscle relaxants can be given, that's all.
One question is, can we grade the severity of nasal sinusitis by X-ray? Dr. Chandrasekhar.
Yes, it depends on what kind of sinusitis it is. Nasal sinusitis, whether it is, you know, uh, uh, due to some infection, fungal, bacterial, and whether it is destroying the nasal septum or it is destroying the turbinates or it is eating up the bones. Accordingly, you can grade. A simple sinusitis, will just look like fluid opacity in the nasal passage. I showed you one radiograph where one side was having a fluid opacity, other side was normal. That was probably a simple sinusitis. And if it is a severe sinusitis, or if it is a bacterial or fungal involvement is there, then eating up of bone will be there, and the nasal septum will be, damaged.
One question is, kindly explain radiography of larynx and pharynx abnormality, please.
Actually, I am not, this does not include the larynx pharynx, so I don't have a proper anatomical.
No problem, sir. I think we are going to cover in the next
we'll cover it
sessions.
cervical. When we do cervical, we can cover that.
Yeah, one is how to differentiate between osteomyelitis and bone tumor, as both conditions will have eaten up appearance.
No, you can't differentiate. You need to do a cytology or you need to do a biopsy to confirm. You can't be very sure that this is osteomyelitis or bone tumor unless you do a biopsy. Nobody can be sure.
One question is treatment for frontal sinusitis. If what's the treatment protocol?
It is antibiotics, and sometimes you may have to, drain the frontal sinus. Sometimes you have to do a, do a drainage, trephining and drainage of frontal sinus. Antibiotics is the course of treatment. Yeah.
And one is how to diagnose, wait. How to diagnose Apellis and the line of treatment.
Apellis, I told you, it will be at the gingival margin. And it will be at the, bone and gingival margin. And when you take a radiograph, depending on what kind of Apellis it is, you may find a lytic lesion, circumscribed lytic lesion in the bone, and it is benign, and you just you have to just resect it, the Apellis.
There is one difficult kind of question Dr. David has asked. I want to know, is it possible to see a reduced density of the mandible under a radiograph and still think it is hyperparathyroidism when it is actually a poorly done radiograph?
See, poorly done radiograph will, you can make out that this is poorly done radiograph because you'll not be able to see other structures as well. But if you are able to see the other structures nicely, but if the bone density is gone, so I think it should not be a problem. A poorly done radiograph means underexposed. If it is underexposed, you'll not be able to see any structure. Everything will look white. If it is overexposed, then even the teeth will look black. So, you will not be able to see other structures as well. So poorly done radiographs are, it's easy to say that this is a poorly done radiograph. Or your parameters are not correct, or underexposed or overexposed radiograph, you should be able to tell that there is reduced. If you are in doubt, you can take another radiograph. There, you always have the option of taking another radiograph. Not a problem.
One question, sir, can you explain open mouth VD view again?
Open mouth VD view. Open mouth VD view. Just a minute. Let me take up my presentation again. I'll just try to show in my presentation again, share it.
Your students are quite excited, sir. I have never seen so many questions in last webinars. A lot of questions are coming, actually. I didn't think that.
Okay, it's visible, the presentation?
Yes, sir. Yes, sir.
So I'll just go back to the. Okay, so open mouth VD view, you have to anesthetize the dog. GA has to be given. You can't do without a GA. Endotracheal intubation is a must. You have to do an endotracheal intubation. Put the animal in dorsal recumbency. So that means the spine of the dog will touch the table. The head should be extended like that. And using bandages, you have to pull down the maxilla onto the cassette like this, right? And using another bandage, you have to pull back the mandible away from the maxilla. Now the mouth is open. And then the beam should come like this into the maxilla, into the cassette. That way you can take the open mouth VD and you will get this particular picture. That way you can see the nasal septum and the nasal passage very clearly. So you can evaluate whether there is any mass or any soft tissue in the nasal passage, whether the nasal septum is eaten up, deviated, whether there is any other problem in the nasal passage. I hope I am clear.
Yes, sir. Yes, sir. There is one thing, one question is there from Dr. Anil. Is trephining possible in dogs, sir?
Yes, it is. Why not? Trephining is possible in dog, but generally we don't go for aggressive procedures in dog because the frontal sinus is not that big. So you generally can treat it with antibiotics, but if required, you can do trephining, not a problem.
Okay, one thing is Dr. Deep Shikha wants to know, maybe it is out of scope of this lecture. She wants to know What is the cause of nasal bleeding and what are the treatments?
Nasal bleeding can be due to so many reasons. It could be due to trauma. It could be due to parasite, hemoprotozoans, E. canis. It could be due to tumors. It could be due to bacterial infection, allergic rhinitis, bacterial rhinitis. It could be fungal rhinitis. So there are so many reasons. There is no single reason you can attribute to for nasal bleeding. It could be sometimes due to heat stroke. Also, sometimes nasal bleeding occurs. So nasal bleeding can occur due to so many reasons. There is leeches in hill stations. Leeches can also cause nasal bleeding. So in hill stations, the dog can or leeches can go up the nostrils. We got a case from Himachal where leeches were there inside the nasal passage and there was bleeding. And when we did a rhinoscopy, we saw the leeches, and then we had to remove the leeches. So there is no specific reason for nasal bleeding, but you can get so many cases, so many conditions which can cause that.
One question is, can we diagnose brain tumors using skull radiographs?
No, you cannot. You need advanced procedures.
What is your choice of fixation in fracture of mandible at angle?
At angle, very tricky question, very difficult to treat. Wiring can be done. We have tried some cases of wiring, commissurotomy and wiring. Very difficult procedure, sometimes very difficult to treat. You can even do plating after doing a commissurotomy and approaching, but very difficult, let me say.
Can cryosurgery be a good option in the oral tumor like Apellis?
Yes, we do a lot of cryosurgeries. Yeah. Cryo and even cautery also.
Okay.
Laser also. Yeah, laser surgery can also be done. Yeah.
Advantages of CT over radiography.
Obvious advantages. There is no there is no comparison actually. There's a massive advantages there.
Sir, what radiographic demarcation will be seen in case of spastic and spastic and
not the scope of this. This is not in the scope.
We are going to cover these.
And paraplegic dog, that is not in the scope.
Indication of contrast canalography.
Canalography means you mean scalography, I suppose.
Maybe
scalography. So you want to see scalocele, mucocele, or scalolith, or salivary gland rupture, salivary duct rupture. So for that you can do canalography, I suppose, if he means the same.
Treatment of recurrent TMJ luxation.
No treatment is there.
No treatment is there.
No.
Sir, what is the GA procedure you do prefer for taking skull procedure? Skull X-rays?
Generally, we give a bag, butorphanol, espromazine, glycopyrrolate sedation. That is sufficient. If we want to give GA, then bag followed by propofol. Even ketamine, xylazine in some cases.
I think there has been enough questions. The rest of the things can be shared with us directly, and we can connect with the doctor.
Dr. Dhruv, canalography, he was talking about ear canal. Sorry. Okay. So canalography, I'll just explain this. Canalography, ear canal. We use urographin or iohexol into the ear in the ear canals. We put the contrast agent and we take the radiographs.
Dr. Anil, it's very difficult to check us what is the second radiograph. What radiograph you mean by that? Dr. Anil has asked the
second radiograph in sequence of radiograph displayed at last of presentation.
Tough question. I mean, I don't understand by which any particular doctor.
What instrument do you use for rhinoscopy? We use a makeshift. Actually, we don't have a rhinoscope. we actually use thyloscope. Thyloscope is a 1 to 2 mm scope used for teat in large animals. So we use that thyloscope. It is a rigid one. It is about 6 to 8 inches long, and that we use for rhinoscopy, but it works well.
I think one more question, or it was the same about that.
Dacrocystorhinography. Yeah, please give little information about dacrocystorhinography. Dacrocystorhinography is a procedure where you evaluate the nasolacrimal duct. So you have to cannulate the puncta lacrimalis at the medial canthus of the eye using a 26 gauge cannula. You can even use a Tom catheter, the plastic sleeve of the Tom catheter, and put it in the nasal, what is it, puncta lacrimalis, and inject about 0.5 to 1 ml of contrast agent. You can use iohexol, you can use urographine, and take a radiograph that will outline the nasolacrimal duct. So if it is blocked, you can know that this is the point of blockage, and then you can use a stillet to open the nasolacrimal duct. So that is a dacrocystorhinography for you.
Dr. Anil has shared the screenshot of the slide, what he wants to be explained again.
What is that? What is that? Just a minute. Let me check what he wants to say in my presentation. Just a minute.
And Darsha, are you able to identify the slide?
I am searching for that.
Okay. Okay.
Okay. I suppose I have got the slide.
You'll have to share your screen, sir.
I am trying to open again. I hope it is this one.
Dr. Anil, you can speak if it is the same one. Yes, I think this is the same one.
Yeah. So now here, if you see that this is an open mouth VD view. This is the nasal septum. Now this side you are able to see a little bit of turbinates here. These are normal ethmoturbinate bones. This side you are able to see the fluid opacity here. Here, around this circle I have drawn here. Now this circle is the area where there is a bit lysis. Some gas opacity is there, some fluid opacity is there, but crisscross pattern of bone is not there. You are able to see some irregular soft tissue opacities and some irregular areas of gas opacities. Now this is typical of some lytic lesion going on. So that tells me that there is something aggressive which is going on inside this. That lysis is extending up to this point. If I will try to draw, let me see. If you see carefully, the lysis appears to be extending up to this point. That is the margin of lysis. Sorry, soft tissue. That is the soft tissue margin. I will just erase it. That margin you can see. I hope that you are able to see that margin of soft tissue. Okay, so this area is full with soft tissue. The left nasal passage, and it is extending to the right side as well. Right, the soft tissue is extending to the right side as well, and there is some lytic area in the center. So this tells me that this is an aggressive lesion. I hope I am clear.
Yes, sir. We are going to organize, and we are just going to conduct the Q&A session. Oh, sorry, this quiz session. Before that, I would like to declare one thing, that Oriheal Life Sciences is already working for the education of veterinarians, field veterinarians. And this is part of that. And this was the first webinar of the year. And I hope if Dr. Saab would have time, we are going to come up with the other lectures also as per his convenience and availability of the time. We have already discussed. So as the new sessions will be conducted, you will be priorly informed, and you'll get the registration link particularly for that particular session. That's why we have not already declared any dates and upcoming sessions, but definitely they're going to be. Dr. Saab has promised us that there are going to be more sessions coming up in this year. Maybe 4 weeks or 6 weeks apart. So first of all, this is the declaration. And second thing is we have YouTube channel also. We have a WhatsApp community, and we have Telegram groups also. They all have their own utility. In WhatsApp groups, we have more than 3,000 veterinarians from all over India and abroad connected to us, and by the name of Buy a Vet for the Vets groups. They are totally silent groups. They get active only when some session is about to happen. And you can be a member of that by joining the link, by clicking the joining link. And second thing, we have YouTube channel that has all the previously conducted webinars on that, so that you can have a better revision. These are for general education purpose, and they are going to be strictly for registered subscribers soon, because we want only veterinarians to be benefited from that YouTube channel. And the third thing is we have Telegram groups by the name of By the Vet for the Vets. There we share PDF format of the books. All international and Indian authors, eminent authors books are there. And the last one is the group named by Vets Jobs. This is my personal contribution to my veterinary community, that new veterinarians or some experienced veterinarians, when they want to switch the job in private practice or somewhere, so they really don't have sometimes the link from where they should get this knowledge. So what happens? Students share their CVs with me directly on my WhatsApp number, and I share that on that Telegram group. And when our friends and clinicians and big practices, they have any vacancies available, they share with us and we post it there. So by that, we are helping our community to get better jobs and opportunities. With that, we thank you, Dr. Sahab, for sparing such a time and patience with us. And there were some technical glitches, but it was his patience that he bared with us, and we finally conducted this whole webinar. And I tell you, sir, we have already seen technical glitches in the previous sessions also, but your students and your audience were waiting patiently for you to come back. So this is your magic.